Hello everyone and welcome to my world. Today we will do a reaction to BBC World Service tackling HIV and AIDS in Africa and globally, what in the world podcast. They will discuss if we can end the HIV infection till the year of 2030. So it would be in 5 years. And let's see. I would assume it would be something really we should have a focus on, but a really short time of period. Even we have now PrEP. PrEP is like a pill you can take where you can prevent to not get HIV at all. And then you have PrEP also for people who have the have HIV and AIDS to prevent to not affect other people. But for this point, we need to do this drug accessible to everyone. If we can do that, then it's something else, and then we will probably not spread HIV further, and the case is getting lower and lower. But let's see what the BBC journalists are discussing and talking about, because this is a topic I'm interested in, because my community is affected most likely with it. So it's a good viewpoint to see and check if we can tackle it. So let's see and have a deep dive today on how we can manage to achieve this goal.
Can we really end all new cases of HIV globally by 2030? It's a goal that's been set by the United Nations, but with millions still affected by the disease and progress being threatened by cuts to USAID funding, how close are we to making it a reality? That's what we're going to be talking about today on What in the World from the BBC World Service. I'm Hannah Gelbart. And to unpack this a bit more, joining us from our Lagos bureau in Nigeria is BBC reporter Makuochi Okafor. Hi, welcome back to the podcast.
Hi, Hannah.
Can you start by just outlining what the symptoms are of HIV?
Okay, so HIV is a sexually transmitted disease. It attacks a person's immune system. Now, the immune system is what sort of protects the body from getting infected from other diseases. What HIV does is, once it attacks the immune system, the body is weak and can no longer protect itself. So other diseases, you get infected easily from things like malaria, tuberculosis, and other infection, any infection that is sort of in your locality, in your area.
What are some of the main things that people believe about HIV and AIDS that actually just aren't true?
There are many wrong information people have out there. For example, that HIV can easily be contacted through physical contact, like handshake or hugs. These are wrong. And this sort of makes, when people have HIV or do know a family member that have it, they don't quickly seek care because they're trying to keep it hush-hush so people wouldn't run away from their friends or their family members. This is sort of one. And also, there's also this assumption that when you have HIV, that means you're promiscuous, so you're keeping multiple sex partners. There is also this.
Wow, okay. I knew about this misconception about HIV, that people are thinking that just if you have a handshake or if you're kissing someone with HIV, you get HIV. That's not true. And it's, in this transition, it's not possible. So these are definitely misconceptions. And I think we still have created this stereotype what HIV people are looking like or how they get viewed, but they look like us, normal people, just with a disease. And for me, it's, or what means normal? If we go by that, nobody is normal at all. But just to make it clear, you can't spot an HIV person just because, just how they look like. That's not possible. And you need to also understand HIV, it's the infection, what you have in your body. And AIDS is the disease. So HIV, you living with the disease in your body, and when it's breaking out, then it's called AIDS. And this is the case when you have where it's more harmful to your body. So, but you can prevent and you can have a normal life nowadays with PrEP and all this kind of things what they did developed. And at the moment they are researching also about 6 months valid um, vaccination, that you have a vaccine against HIV to get HIV. So, and you need to have the vaccine every 6 months. So it is not right now on the market, but they found a vaccination for HIV to prevent to get it. Not that it's a cure, but if we are developing in the next year or all the years, maybe in some days there will be a cure also for HIV. But let's see. This, I don't want to promise anything, but this is they are researching about that. And the good thing is that we already have a vaccine for it, or it's in the process to become more available.
Wrong assumption that HIV is a punishment from God, or, because people feel like you're not moral enough, and that's why you're being punished. These are sort of the few very popular and prevalent misinformation around HIV and AIDS. And HIV is in a death sentence. Thankfully, we have lots of tools to help people survive. So sometimes people think that once you get HIV, this means you're going to die. But this isn't accurate, because we've seen lots of people live over decades, with available tools and treatments around HIV. So these are sort of the misinformation around HIV that you can hear both here on the continent and even beyond the continent.
As you say, there is treatment for HIV so that it can now no longer even be detectable in people's blood, right?
Yes, you're very accurate. So there are drugs called antiretroviral drugs, which people living with HIV can take. Now, this sees that when you're taking this drug, you do not pass on the virus to, for example, a partner. Or there are drugs that prevent mothers from passing on HIV to their unborn kids. There are also drugs like PrEP, which sort of protects people who feel like they might be getting in contact with HIV, with the virus, more or less. So there are lots of tools available. And then there are things like contraceptives that, to an extent, can also protect you from things like condom, protect you from getting HIV or AIDS. So there are lots of tools now. So it's not as scary, quote unquote, as it was in many years ago.
Where are cases of HIV highest in the world right now?
Globally, the African region is the region with the highest HIV prevalence, particularly South Africa.
Just because of the access of the drug to prevent for that, because they cost. Most likely in those countries, you need to pay for them. And sometimes you can't pay because the low income countries have not the accessibility for that. For in case like I'm from Germany and you can have this drug prescribed when you have HIV. So you can live a life because it's accessible. In Portugal, it's the same as you can be in a health system and your health insurance cover the cost for your for the prevention of HIV. So the cost is covered in the health security system. Sometimes, but with low value income countries, you don't have this prescribed health system or an insurance card, and that's why the numbers are way more higher there, and still deaths on HIV it's equivalent to that because they can't afford it, or they need to work on it, and then they get the drug from other stores. But we should have a global system of health insurance where we cover diseases that are treatable, and that those people to also overcome the affection of HIV, to have a global system where we help others with the diseases to get the prevention for it. And I think this is the most likely where we need to focus on if we want to stop spreading certain diseases to to a society.
With about 8 million people living with HIV in the country. Countries like Botswana, and Malawi in Africa have seen, considerable reduction. But also in the continent, speaking about continents, the European continent has seen slight increase recently. But in Africa, the Tigray region in Ethiopia has seen increase in cases of HIV, and this has been because there's been prolonged conflict there, and there's also cases of sexual violence being used in this conflict that has impacted lots of people living there.
What about PrEP? How is that contributing to changing rates? You said that they've gone down quite a lot in the last 10, 20 years.
This has been such a strong tool in preventing and protecting people from getting HIV. And what people have done, or what some countries have done, is include PrEP in their primary healthcare services, which has been very helpful. And lots of countries, it's either subsidized or is free. So it also kind of increases and improves access to getting it. So the medication has actually been a strong tool in helping protect people and prevent HIV across countries globally. Discrimination has...
Yeah, that's true. But also, I can just tell for my community that people are using PrEP. They try to have it equivalent to not using a condom. So, just for the understanding, PrEP is saving you or is preventing you to get HIV. But PrEP is not preventing you to get the other transmitted diseases like syphilis, gonorrhea, what else, or a tripper. But there are now also other pills you can use where you also not get these diseases. But in my opinion, you should always try to minimize your infection rate to your body. And PrEP is a good thing to use if you are anxious and trying to not get HIV. But the best thing what you should use also as a male person with a penis is a condom. So condoms definitely will help you a lot to not get infected with other transmitted diseases. So, and we should talk more about the prevention, but we also should try to evaluate to use more condoms. If you are in a committed relationship and you know each other, and most likely monogamous, or if you're polyamorous, but you're just exclusive for your 3 or 4 partners, then it's fine to have not a condom or using not PrEP. But if you don't want to get any of these diseases, it's always discussion also with communication. You don't need to be afraid to talk about it if you have those kind of diseases and what is happening. Because if it's not HIV, you can go to your doctor and then you have the opportunity to get a vaccine or in a drug to cure from a tripper, from those kind of things, because they are treatable. And this is just a misconception that if you're using PrEP, that you can't catch any other disease. You should just being aware of that. But you should always ask yourself or understand how this is working, and you shouldn't be afraid about any HIV person. And this is a thing, because if we're getting afraid or if we are anxious about it, we creating an environment which is discriminating people with HIV.
Stigma is a huge problem for lots of people. I'll give you an instance. I know and I've heard people say that once they see someone taking PrEP, they assume the person is HIV positive. And this is not accurate. And there's so much stigma tied to HIV. So that means even those who do have HIV or who should be taking PrEP are discouraged from taking it because they feel like, oh, people are going to see me taking it, or people are going to see me walking into the hospital to pick PrEP, and they wouldn't take it. These are some of the issues. And then there is also this issue where people think that if you're taking PrEP, you are associated with the LGBTQ community, and this is very wrong, because PrEP is for everyone who should be taking it as prescribed.
And one of the issues, of course, is going to be funding. At the start of the year, the US President Donald Trump said that he is dismantling USAID, which is the US foreign aid. What effect is that having on HIV treatment on the continent?
For many countries, for example, I remember the WHO was saying that countries like Nigeria or Kenya could run out of medication, and that's because most countries have relied on aid in having these drugs available for their citizens. I'm not saying that it's completely all the drugs, but most of the drugs that are being used, they get support from foreign aid. But now that this been cut, it's definitely going to impact people's access to these drugs. For example, I know there's an NGO in Nigeria that used to offer free PrEP for citizens and for people. Sometime in the wake of this cut, they put out an announcement to say they won't be doing that anymore because they no more have access to bringing in these drugs. And this means that people now have to either rely on getting it over the counter and paying out of pocket. For many people, this would be too high. I do know that the drugs, for example, in Nigeria, go as high as 70,000 naira, and that is a lot for many people. There's data from South Africa saying that there's been reduced testing in lots of communities, and this has been because both the testing and the treatment have mostly relied on aid from the US, for example. It's true that some part of PEPFAR was resumed, but it's not all, and that means that the space and the gap that has been left needs to be filled, and while that is happening, people's lives are being impacted.
You mentioned PEPFAR, that is the US's HIV program. It stands for the US President's Emergency Plan for AIDS Relief. So there's PEPFAR, there's USAID, and it's all a bit confusing because they were frozen, then unfrozen for a bit. So now we are going to go to the US to explain a bit more.
So earlier this year, President Trump put a pause on all funding for USAID. That's the United States Agency for International Development. And their job is to send money abroad for things like health programs, especially in low-income countries, and especially for things like HIV. So when this 90-day freeze took effect, a lot of these programs took a hit because they could no longer rely on U.S. support. And one of these programs was PEPFAR, and it's been credited with saving 26 million lives, with enabling 7.8 million babies to be born without HIV. So Congress went ahead and stepped in. They issued a waiver, which meant that they could access the funding immediately. But even by then, it was too late, and a lot of these systems were already dismantled. So a lot of these clinics had closed, a lot of these doctors had been relieved of their duties, and a lot of people stopped taking their medication because they didn't have access to it anymore.
So, Makuochi, are any of the countries on the continent filling these funding gaps themselves?
Well, the truth is the cut was a bit unprecedented, and I'm sure many countries didn't make provision for it in their budgets. But what has happened is, at the wake of this cut, countries like Nigeria, Malawi, and Uganda have sort of made quick adjustments in their budget or made provisions to help see that people living with HIV are cared for and protected, and even those communities who might be at risk are also given the care that they need. So these are sort of the quick adjustments that countries have made, but it'll be interesting to see how this rolls out and if it can fill up the gap already existing after this cut.
At the start of the episode, I mentioned the UN's goal, which is to completely get rid of all new cases of HIV by 2030. Are there any countries that are on track to do that?
Well, countries like Uganda had achieved over 97% coverage for their target in reaching both preventions and testing for HIV. Even South Africa had also done quite well in over 90% or about 90% in their targets towards reaching this coverage in terms of both treatment and prevention. So yes, many countries or some countries have been on track, but with this sudden cut, it's a bit worrisome how this will be and what could play out because lots of experts have raised their concerns about how the impact this cut would have in the progress being made.
Apart from the international funding they were getting, what kind of strategies were they using to get, you mentioned 90% elimination rates?
First of all, what some countries did was to integrate their HIV treatment and prevention and testing programs to the primary health care. So that means it was easy to walk into any primary health care and get the care you need and even get your medication or get tested. And not only were these available, for most countries, it became subsidized or completely free. So you didn't have to think of paying out of pocket to access these programs. What other countries also did was to move their treatment or their programs to communities. So you don't have to think of going to the hospitals. The programs did come into your community, and that also provided an avenue to ensure that there were public health awareness in those communities. Teaching people about prevention, teaching people about what treatments are available, teaching people about what misinformation is accurate and what is inaccurate. So these are sort of the programs or strategies that some countries did implement.
So what do you think it would take for us to reach that target globally to get rid of all new cases of HIV by 2030?
It's tricky to say, but some of the experts I've spoken to have told me that things like increased funding would totally help in increased funding in HIV and AIDS programs, but also even funding research around finding new ways to either combat HIV or reduce HIV. As we know, there are lots of research going on, but improving and advancing this research could perhaps help us come quite close to stopping HIV by 2030. But also there's also need to make more efforts around stopping or reducing stigma and misinformation around HIV and AIDS. These are sort of the things that can help us get there by 2030.
Makuochi, thank you.
Thank you so much, Hannah.
Okay. Yeah, I hear about that already. That since Donald Trump is attacking also universities and all this kind of things, that he's defunding a lot of research work in these sections, and this can be a huge issue because America is one of the highest possibilities for research, or it was. Since with Donald Trump, he's attacking the researchers and defunding them with the money from the government. So, and this would be also affecting this field to HIV resource and researching. And I hope 2030 could be reached, that we can have this kind of impact in this field, and also that we can stop new cases to appear or lower them to a minimum. And maybe in the future we have the accessibility also for a cure or a stable vaccine. If you get vaccinated, that you are not get infected or something like that. It would be amazing. Or every year or every 2 years, let's see how this is possible and how this will be working and going on. But fundings are fundamental for researchers, and most likely if you're going to research, you need to back certain departments to get money on it. And it is most likely that a lot of people, if this is risky like that they will not fund because they always have the side of profit. And in capitalism, if something is just for researching, the profit is not coming immediately. You just pump money and into the research and have the effect maybe in 15 or 20 years or something like that, or even longer. And this is not profitable for most companies. But for the social system, it is a great impact and reducing several kind of things. So let's just finger crossed if this gonna happen, that we have an impact to decrease the infection rate of that. PrEP is already a good thing, and also when the vaccine is coming and it's be fully available, I think this is the next step where we definitely can reach the goal of 2030. I found it quite informative, this little short video. I hope you too. Talk in a comment with me. How do you feel about that? Do you have any misconception about HIV? Then we can also discuss that in a comment. And if you have any doubt, just let me know and we can talk about it. If you like the little reactions, then a thumb up would be really appreciated. And of course, if you didn't subscribe me yet, I really appreciate a subscription from your side, and wish you right now a good day, a good evening, or good afternoon. It's depending when you're watching this video. And make your hot coffee, a tea, or a hot chocolate. See you and bye-bye.